Kyle, thank you so much for sharing that information. Just to recap what I heard to make sure that we're on the same page. Right now, you are having difficulty getting consistent reports back from your current provider.
That's right.
Okay. You've also had several cases that have gone on longer than you thought that they should have.
Correct.
Good. Okay. Well, I want to tell you that you're not alone. We speak to many employers, and we're hearing a lot of the same things, these same frustrations. So what I'd like to talk to you about today is what Concentra's been working on specifically to address the issues that we've talked about and your frustrations, but also give you some information on what every employer should look like as far as their whole entire comprehensive workers' comp program. How does that sound?
That sounds great.
Okay. So like I said before, Concentra's been in business for over 30 years. We're constantly looking at improving ourselves, improving our service delivery. So for us to do that, we really had to understand, what does a good workers' comp program look like? So we started out internally looking, asking employers like yourselves in a format of focus groups across the country, asking them, hey, what's important to you when it comes to a workers' comp program? And, we got a lot of great information. Then we looked externally at journals and articles and white papers from the experts. And we actually have our Chief Medical Officer, Tom Fogarty, contributes to these publications, so we had a great resource in him. We were able to combine all that information and really put together a top 10 list of what an employer should have to have a best-in-class occupational health program. Now, one thing I want to make very clear is that this was not developed by Concentra. We put this list together based on our research. What's funny is based on what you told me, you said that you had some issues getting some reports back, and that is actually right here as one of the 10 elements as part of a structured and managed communication program. But as you can see, there's actually one more piece to that the experts are saying that you need to have really a rounded communication package, and we'll touch more on that. Also, you said there were some cases that went on a little too long in your opinion, and that falls right here with a focus on outcomes. But as you can see, there's also two more areas under that section that really will flesh out your program, and that is document occupational medical expertise of your provider and also the access to clinicians. So we'll really talk about those as well. Now, when you look at this color coordination, what Concentra has done, when we looked at this top 10 list, there was a logical grouping of these, and so what we came up with was a 4-key ecosystem. And what that's really meant to do is, as we look at aligning our business to match these top 10, this really helped us to do that, and also help you as an employer understand what this program looks like. Now, the 4 keys are employer engagement, patient engagement, clear communication, and quality medical outcomes. The two that we circled, that we just talked about, fall underneath clear communication and quality medical outcomes, and that's where we're going to spend the most time today. But I want to just touch on these two because I don't want to discount those. These are also important when you're looking at having a comprehensive program. Employer engagement really is how do you engage with us, and how do your employees access care? Patient engagement is really how your employees are treated, and we can touch on that a little bit further, but based on our conversation and the needs that you have, the two that we're really going to hone in on is clear communication and quality medical outcomes.
Wonderful.